Have you ever wondered what oral implants are all about? A question that may have crossed your mind as you leaf through brochures in the waiting room of your dentist's office, or as you scroll through health articles online. Oral implants are a common dental procedure, and they're often used to replace missing teeth, providing a sturdy, long-lasting solution that can help boost your confidence and enhance your smile. Now, you might be asking, who needs oral implants? Well, if you've lost a tooth due to injury, decay, or disease, or if you're simply not happy with the fit and feel of dentures, oral implants could be the answer you've been seeking. In this video, we'll take a deep dive into the world of oral implants. We'll guide you through the process step by step, shedding light on what you can expect, and offering tips and insights along the way. So, gear up and stay tuned as we unravel the mystery of oral implants. So, what exactly are oral implants? Well, in the simplest terms, oral implants are artificial tooth roots that provide a permanent base for fixed replacement teeth. They're a popular and effective long-term solution for people who suffer from missing teeth, failing teeth, or chronic dental problems. Think of them as strong, sturdy pegs. These pegs, usually made of titanium, are surgically placed into your jawbone where teeth are missing. Over time, they fuse with your natural bone, creating a firm foundation for artificial teeth known as crowns. Why titanium, you ask? It's because titanium is a biocompatible material. This means it's not harmful or toxic to living tissue. In fact, it's often used in medical procedures for its durability and compatibility with our bodies. Now, atop this titanium implant, a small connector post called an abutment is placed. This serves to securely hold your new tooth. Finally, a crown, custom-made to match your natural teeth, is attached to the abutment. But oral implants aren't just about replacing missing teeth, they're also about restoring the quality of life. They allow you to eat, laugh, talk, and smile with confidence. They don't come loose like dentures can, nor do they require reducing other teeth, as a tooth-supported bridge does. Moreover, oral implants help maintain your facial structure, preventing potential bone loss in the jaw. This can happen when there are no teeth roots to stimulate the natural process of bone renewal. So, oral implants are like superheroes of the dental world. They step in when natural teeth can't perform their duty anymore. They're made from mighty materials like titanium to fight off the villains of tooth decay and gum disease. And they're here to save the day, or rather save your smile. Now that we know what oral implants are, let's explore how you can get them. The journey to getting oral implants is an interesting one. It's a journey that begins with a simple step: a consultation with a dentist. Here, your dentist will assess your oral health, discuss your dental history, and examine your mouth and jawbone to determine if you're a suitable candidate for oral implants. Next comes the planning stage. Your dentist, perhaps in collaboration with a specialist, will develop a personalized treatment plan. This plan is tailored to your specific needs, taking into consideration factors such as the number of teeth you need replaced and the condition of your jawbone. Now, we move on to the actual implant surgery. This is typically a two-stage process. The first stage involves placing the implant into your jawbone. This implant, a small titanium post, acts like the root of your tooth. It's inserted beneath your gum line into your jawbone. This surgical process is done under local anesthesia, so it's not as scary as it sounds. After the implant is placed, you'll enter a healing period known as osseointegration. This is when the magic happens. The implant begins to bond with your jawbone, creating a sturdy base for your new tooth. This process can take several months, but patience is key. It's this bond that gives your new tooth its strength and stability. Once the implant has fully integrated with your jawbone, it's time for the second stage of surgery. Your dentist will attach a small connector post, or abutment, to the implant. This serves as an anchor for your new tooth. Finally, it's time for the grand reveal. Your new tooth, or crown, is attached to the abutment. Your dentist will ensure that it matches your natural teeth in color, size, and shape. And there you have it. A new tooth that looks, feels, and functions just like a natural one. That's a basic overview of the oral implant process. But what should you check before going for this procedure? Before getting oral implants, there are several things to consider. Firstly, the expertise of the dentist. This is crucial. You want to ensure that the dental professional who will perform the procedure is experienced and highly skilled. Ask about their success rate, the number of procedures they've conducted, and their educational background. Don't shy away from asking for references or testimonials from previous patients either. Now, let's talk about cost. Oral implants can be quite an investment. It's important to get a detailed breakdown of the costs involved before going ahead with the procedure. This should include the cost of the implant itself, the dentist's fee, and any additional costs such as X-rays or follow-up appointments. Don't forget to check if your insurance covers any portion of the procedure. Next on the list is the hygiene standards of the facility. This is non-negotiable. The clinic or hospital where you will have the procedure done should adhere to the highest standards of cleanliness and hygiene. Look for certifications or accreditations that back this up. Now let's not forget about potential risks and complications. Yes, oral implants have a high success rate, but like any medical procedure, they come with a degree of risk. These can range from infection to nerve damage or sinus problems. It's vital to discuss these potential risks with your dentist, understand how they might affect you, and what steps can be taken to mitigate them. Lastly, consider the time commitment. Oral implants are not a one-and-done procedure. They often require several visits to the dentist over a period of months. So, be sure you're prepared for the time investment and have a plan in place for managing your normal routine alongside your dental appointments. Once you've checked all these boxes, you're ready for the procedure, but what could possibly go wrong? Every medical procedure has potential risks and complications, and oral implants are no exception. Just like any other surgical procedure, oral implants carry a certain level of risk. While they can significantly improve your quality of life by replacing missing teeth, it's crucial to understand the possible complications that can arise. Knowledge, as they say, is power. One common complication is infection at the implant site. This can occur when bacteria infiltrate the area either during surgery or post-operation. The signs of infection may include swelling, redness, or discomfort around the implant site. While it may sound daunting, don't fret. Infections are typically managed with antibiotics and good oral hygiene practices. Another potential issue is nerve damage, which can result from incorrect placement of the implant. In rare cases, this can lead to numbness, pain, or tingling in your natural teeth, gums, lips, or chin. This is why it's so important to choose a qualified and experienced dental surgeon. They will use precise imaging and surgical techniques to avoid this complication. Then there's the risk of implant failure. This happens when the bone doesn't fuse properly to the implant, often due to insufficient bone density or smoking. Implant failure can also occur if the implant is subjected to too much pressure too soon, such as biting down hard before the implant has fully healed. But what if an implant fails? Well, in many cases, the failed implant can be removed, and after a healing period, a new one can be placed. So, while it's a setback, it's not the end of the road. And let's not forget about sinus problems. These can occur when implants placed in the upper jaw protrude into one of your sinus cavities. But again, with a skilled dental surgeon, this is a rare occurrence. All these complications might sound intimidating, but remember they are rare, especially when the procedure is carried out by an experienced professional. Being aware of these complications helps you make an informed decision about oral implants. So arm yourself with knowledge and step into your dental journey with confidence. So far we've learned a lot about oral implants. Oral implants, as we've discussed, are artificial tooth roots placed into the jawbone to replace missing teeth. They are a popular solution for individuals seeking to restore their smile and enhance their quality of life. Getting oral implants involves a surgical procedure, typically performed by a dental specialist. It's important to remember that this isn't a one-size-fits-all solution. Before going through the procedure, it's wise to complete a pre-implant checklist, ensuring you've considered factors like your overall health, the condition of your jawbone, and the cost. While oral implants have a high success rate, complications can occur. These range from minor discomforts like swelling and bruising, to more serious issues such as infection or nerve damage. Remember, oral implants can be a great solution to dental problems, but always consult with a professional to make sure it's the right choice for you.